Dr. Marshall here at Medical Specialty Clinic. Today I wanted to do a video on or related to hair loss. I get a lot of questions about what are some things that people can do to help slow down or prevent hair loss, and in some cases reverse it. And of course, obviously I get asked about what causes hair loss, but more often than not, patients are interested in solutions to a problem that they're having with their hair thinning for various reasons. So there are a few things that can help. There's not a great deal, but there are a few. So first off, just good nutrition. So you want to make sure you're getting plenty of protein in your diet, help build hair follicles, help build strong, healthy hair and nails. Hair and nails are related to each other in how they're made, so they use similar building blocks. Supplements, then you move into supplements. So a good multivitamin, biotin is actually really good. And then a collagen supplement is also a good idea. And then glucosamine, chondroitin, things that are good for joints can also help some. In particular, there are some vitamins now that are geared specifically toward hair loss and slowing down hair loss. And Nutrafol would be one. I think there are others, but Nutrafol makes a pretty good vitamin, and they have three, I believe they have three different types. They have one for women before menopause, and then they have one that's geared more toward women after menopause, and then they have one for men. So Nutrafol vitamins, you can look those up. I'll leave a link in the description for Nutrafol. And then other things you can do, there is topical treatments. So things like Rogaine, I think people have heard of that. So Rogaine is a substance you can rub on your scalp, and that can stimulate new hair growth. It's been shown to do so in studies, clinical studies. And then, believe it or not, rosemary oil can actually help. And when it's been studied head-to-head with Rogaine, it did just as well. So rosemary oil and Rogaine topically, there's creams and oils and foams that you can use, things like that. So to varying degrees. So those are a good idea. And then a good exfoliation of the scalp can help. So you want to make sure the pores aren't clogged so that the new hairs can grow. So not too much. You don't want to be too rough because that can damage new fragile hairs, but exfoliating can be good. And I think Nutrafol actually makes a scalp cleanser that you can use to help with that. It's geared toward that. I don't know that that's actually been proven to help, but they do offer that product. And then obviously there's several shampoos that are offered. Nutrafol makes shampoo and conditioner that can help with hair loss, as well as other brands. I'm familiar with Nutrafol, but there's several other brands that make shampoos to help with hair loss. You do want to make sure you get a good quality shampoo. They're usually going to be a little more expensive than some of the others. And then one other option that has been shown to help, but is actually a little bit painful, is dermal rolling. So you take several millimeter, basically needles on a roller, and roll the scalp. You can Google that and see what that's like, but it actually, you need to get to a certain depth in the scalp. So it takes a fair amount of pressure. It's fairly painful, but if you do that regularly, once a week or so, that can actually stimulate new hair growth. And then another somewhat painful option is PRP, platelet-rich plasma. So they can, certain clinics can draw your blood. They will take that, put it in a centrifuge, and spin it down and separate the red blood cells from the serum. And that serum has got some platelets and growth factors and things like that. And then they can take that and inject it right under the skin in the dermal plane, in the dermis, which is not pleasant. And you can't numb it up because the lidocaine, my understanding is the lidocaine will destroy the PRP or make it not work as well. So you can't really numb up the skin. You have to do it without deadening. So, but that can help, and that has been shown to do very well. It's just not comfortable, and you can do that about once a month. PRP is very good. That's probably the most powerful, most consistent option out there. So that's the one that I would recommend if somebody was interested in trying to see if that, because you could see results that within a month or two. It usually takes several months for the supplements and things like that to start work the dermal rolling. Usually you have to wait at least 3 months, if not 6 months, to actually see any results. But they usually are there. They're just not quite as good as with PRP. And the dermal rolling, just back to that for a second, that actually can cause you to lose a little hair because it can be cut. It can cut some of the hairs that are there, so it can look like you actually lost a little hair, but it's not destroyed. It'll grow out. It's just it can cut it off, and in some ways make you look a little more thin right after you have it done. Most people do that themselves. They just get a dermal roller. You can buy those on Amazon or other shopping websites, and run that across the scalp in the areas that are concerning, and do that. And then one other option is laser, real low energy laser treatment to the scalp. Several companies make helmets that have the laser treatments, and you do that usually every day. It can vary, read the manufacturer's instructions on that, but laser stimulation of the scalp can actually help with hair growth. And I've got one brand here that I'm familiar with. This is a laser cap. This one is by iRestore. So you can search that. I'll leave a link for that too. But you can search that, and you just put that on, and you look very professional. It's got a controller that turns it on, and that works. You do that for about 30 minutes each treatment. I will take that off. I want to get you laughing too hard, but anyway. Also, not only patients ask me about it, but obviously my hair is thinning. You can tell I'm probably going to be fairly bald here before long. Well on my way anyway. So I hope you enjoyed the video, and I hope you got some information out of it. If you have any other questions, want to discuss it with one of the providers at the office, just give us a call, 731-257-1500. If you like the video, got something out of it, like and subscribe. It helps us with the algorithm. Try to get some more of these videos put together for you. Anyway, thanks for tuning in, and I'll see you in the next one.